Okay, we are on. All right, so. Hi, my name is Jeff, and this is my head-to-toe nursing assessment for Nursing 361. And here I have with me my daughter Finley, who is going to be my patient. So normally I would be wearing a mask and gloves, but given those are short supply right now, I'm doing it without. But okay, so let's. Hi Finley, my name is Jeff. I'm the nurse here, and going to be doing a head-to-toe assessment on you.
Yes.
Okay. Mm-hmm. So I'm just going to kind of guide you through all the steps. You don't have to do anything. I'll tell you what you need to do. Yeah. Okay.
Yeah.
So, can you tell me your name?
Finley.
And how old are you?
I'm 8. 9.
9. Okay. And that's okay. And can you tell me where you are right now?
I am in the doctor's office.
You're in the doctor's office. Excellent. Okay. So it's good to see Finley is alert and oriented. Finley, if you don't mind, I'm just going to have you get up and walk around in a quick little circle right here.
Okay.
Just nice and normal. Okay, a little bit bigger. Okay, now I want you to go up on your toes and walk as well. Okay, she has a nice steady gait. All right, Fee, you can have a seat here.
All right.
Okay, I'd like to see you just sit up nice and straight there for me. Okay, so she has good posture. One thing I like to see. So Finley, so some of the things I have to do, I'm gonna touch your face and different parts of your body. Are you okay with that?
Yes.
Okay, so what I will start with is we're gonna start because we're doing head to toe. So I'm gonna start with your head. So I'm gonna palpate her scalp, and while doing so, I'm also checking her hair. She has nice, healthy looking hair. I don't feel any lesions, any lumps, anything of concern. Everything feels as it should, nice and in place. Finley, can you tell me any cuts, bruises, bumps, any lesions? A little cut there, okay, but nothing out of the norm that we should be concerned with. Okay, so looking at Finley's skin here, she has good skin color. Okay, I don't see any rashes or anything of concern. We're going to look at her nail beds here. Just relax. Okay. Checking her capillary refills. All looks good there. Finley, if you don't mind, I'm just sit up nice and straight. I'm just gonna pinch here. Okay. She's got good skin turgor. It means we're checking for is to see how well hydrated you are and taking care of your skin. That's excellent. Okay, I'm gonna have you look straight at me. I notice everything looks nice and symmetrical. Her ears, her eyes, eyebrows, everything looks good there. I'm just gonna go on my knees because I'm a bit too tall for you. Finley, can you raise your eyebrows for me, up and down? How about a big smile? Let me see your teeth. Yep, excellent. Okay, and I'm just going to touch your face if you don't mind. Okay, so I'm just feeling for some TMJ. Can you open and close your jaw? Excellent. Nice job. Okay, everything looks good. I'm just going to touch around your eyes. Okay, nice sclera. Everything's nice and white. Excellent, Finley. So I'm just going to tap around on some different parts of your face. Mm-hmm. Okay, I'm just going to push up there. I'm just palpating different parts of her face. We're assessing different nerves. Excellent. While I'm here, Finley, I'm just going to feel your neck. Yep. I'm going to check for her some pulses here. Excellent. I'm going to palpate on her neck. We're going to feel for her thyroid. Everything feels good, nice and in alignment. Excellent. You're doing great, Finley. Okay, so what I'm going to do is you're just going to look straight at me. I'm going to test her pupils, make sure they're equal and reactive. So I'm going to shine a light. You just look at me. Don't worry about the light, okay? So, okay, left eye's good. Excellent, Finley. Excellent. So next what I'd like you to do is I'm going to have you cover your left eye. Okay? I'm going to hold up some fingers. You just tell me how many fingers I'm holding up, okay?
2, 3, 5.
Excellent. Okay, put that hand down, blink a few times. I'm going to have you cover the other side. Normally this would be easier done with a Snellen chart. Okay, again.
3, 1, 2.
Excellent, Finley. Excellent. Go ahead, put those down. Okay, next what I'd like you to do is cover your left eye again. And I want you to touch your nose to my pen. Excellent. Excellent. Okay, now switch up. Switch eyes. Okay, you can blink a few times. So I am jumping around a little bit here, and I apologize. We are doing some fine motor skills here too. Okay, so you go ahead and put your hands down. Okay, so what I'm going to have you do next is we are going to check the 6 cardinal signs with her vision. So what I'm going to have you do is you're going to keep your head straight on at me. However, you're going to follow the pen with your eyes wherever I move it, but don't move your head. Okay? All right, here we go. Excellent, Finley. Excellent job. Excellent. You did great there. Okay, so next up what I'd like to do, especially since you're touching your ear, we're going to test some hearing. Okay, let me just feel your ears here. Normally I would look in. I don't have the right tools to do so. So what I'm going to do, Finley, is I'm going to cover one of your ears, and I'm going to whisper something in the other ear. You're going to look straight ahead. I don't want you to read my lips. And when I say so, you're going to repeat back to me what I said. Okay? So what I'm going to do is I'm just pushing there to cover your ear. Okay? Christmas. Okay, Finley, what did I say?
Christmas.
Excellent. Excellent job. So now I'm going to do the same thing on the other side. So what I'm going to do is I'm just pushing in there. Okay, you can look straight ahead. Do not look at me. I see you trying to peek. Okay, all right, ready? Jingle bells. Okay, Finley, what did I say?
Jingle bells.
Jingle bells. Excellent job. Okay, so let's see here. Can you open your mouth for me? Big open. Stick your tongue out. Say ah. Excellent job. Close your mouth. Puff your cheeks out. Nice and big. Excellent. Excellent. Okay. What I'd like you to do now is we're gonna test some of her nerves and whatnot. And what I want her to do is you're gonna tilt your head. I want you to touch your chin to your chest, just like that. Excellent. Bring it up. Look up at me. Okay. And then go side as far as you can. Excellent. Nope, don't shrug your shoulders. Other side. Excellent job. Excellent. Now straight back up. Okay, so since you were shrugging your shoulders, what I'd like to do is I'm gonna test. So I'm gonna push down on your shoulders. I want you to kind of shrug your shoulders up while I'm pushing down. Excellent, excellent job. Nice and strong. All right, so let's see. Her temporal pulses here. Excellent, nice and strong. Can you hold your hand straight out for me? Excellent. So what I want you to do is push down. Excellent. Now flip your hands over. Nope, other way. There we go. And now I want you to push up, and I'm going to try and keep them in place. Excellent. Let's see. Put your arms out. Okay, nope, straight out to your sides. Go up and then down. Okay, I'm just palpating her joints right now. Go ahead, down. Okay, elbows in and out. Okay, your wrists up and down. Excellent job. Okay, while we're here, what I'm going to do is I want you to relax your arm. And I'm just going to test some of her reflexes in her arm up here with my stethoscope. Okay. Excellent. You see how your arm kind of moves on its own? It's kind of funny, huh? So now we're going to do this side here. Just relax. Just relax your arm. I promise I'll give it back. Excellent. You see how it kind of moves on its own? Mm-hmm. Okay. What's neat is I could do this on her legs as well with her knees. Again, testing the reflexes. So just let your legs hang. I'm just going to tap lightly just below the patella, your knee there. Okay. So, excellent. All right. Now let's do this one. Oh, excellent. Let's go back to this side. Isn't that funny? It is kind of funny. All right, let's stay serious now, okay? So, let's see, what else do I want to test on you, on your face? So what I'm going to do is we're testing some of the facial nerves and whatnot for sensation. So what I'm going to have you do is you're going to close your eyes, and I'm going to use my tissue here. It is clean, I promise. I'm going to wipe. I'm going to softly touch each side of your face. You can close your eyes. When I'm done, I want you to tell me if it feels the same on both sides, okay? So close your eyes. Okay. Did that feel the same?
No.
No? Well, that's a problem.
What?
You sure? It should feel about the same. No?
No.
Okay, let's do it again. All right, I want you to close your eyes. You feel that light touch?
Yeah.
It feels relatively the same?
Mm-hmm.
Okay. She has me a little concerned there. All right, so I'm going to do the same thing with your arms and your legs. I want you to close your eyes. And again, just a light touch. And actually, I'll use my hands. Maybe that'll be a little bit better. And you just tell me, does that feel the same on both sides?
Yes.
Excellent. Okay, now I'm going to do your upper legs and then your lower legs. You tell me if that feels the same on both sides, okay? Feel the same? Excellent. Okay, I didn't do it while I'm down here by her feet. What I'm going to have her do, I know it's kind of hard to see with the camera. Let's see if we can tilt this down a little bit. Oh boy. Let's do this. Okay, so now looking at her feet, what I'm going to do is, what I'd like you to do is stick your feet out, toes out. Nope, just relax. Okay, so I'm going to put my hands under your feet. I want you to push down. I'm going to put my hands on top, and I want you to pull up. Okay, so we're just kind of testing your strength and some of your nerves there as well. Push down, down, excellent. Okay, pull up, 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 excellent. While I'm here, I do notice good color in her skin. I don't see any edema. Again, down here, good capillary reflexes. Let's check your pedal pulse. So I can actually feel your heart beating down in your feet, pumping blood. Isn't that wild? Okay, just relax. Excellent, nice and strong there. Okay, so Finley, what I'm going to do is, if you don't mind, I'm just going to listen to your lungs, okay? So I'm going to turn the camera back up a little bit. Perfect. Okay, so I'm just going to take a seat next to you. Okay, so I'd like you to take big deep breaths in and out.
Yep.
Excellent, Finley. So she has nice, good, clear lung sounds throughout. No concerns there. So Finley, if you don't mind, I'm just going to tap around on your back a little bit, okay? Okay, any pain anywhere, Finley?
No.
No, no pain. Okay, so we're just kind of over her kidneys now. No pain there. Okay, so Finley, if you don't mind, I'm going to have you stand up for a second. Mm-hmm. Maybe turn. Face me. I'm going to have you bend over and touch your toes. And we're just kind of, so what we're doing here is we're looking at her spine for symmetry to make sure there's no scoliosis. Okay, everything looks Everything looks good. Everything's nice and even. Spine is nice and straight, and kind of palpate while I'm there as well. Okay, Finley, if you don't mind, I'm going to have you take a seat back here on the bed. Okay, so what I'm going to do is I'm going to inspect her abdomen. So Finley, if you don't mind, I'm going to have you swing your legs there, head here. And I'm just going to put this stuff over here. Okay, so first what I'm going to do is I'm going to auscultate, which means I'm going to give a listen to your belly for some bowel sounds, make sure everything sounds the way it should. Okay. Excellent. So she has good bowel sounds in all 4 quadrants. Now, Finley, what I'd like to do first is I'm gonna push on your belly in different spots.
Yeah.
Okay, I'm just kind of feeling to make sure everything's where it needs to be. Okay, so again, just a lightly palpating her abdomen, and now I'm gonna go a little bit deeper. Okay, so I'm on the left side. I'm feeling for any enlarged organs, liver, spleen, stuff like that. Don't worry, we don't test to see if you're ticklish. Okay, so everything feels good on Finley. She has good bowel sounds. Actually, if you don't mind putting your knees down while you're in this position here, I'm just going to listen to your heart region. Is that okay with you?
Yes.
Okay. So again, I'm just going to kind of okay, that all sounds good. I'm just going to kneel down here, and I'm using my stethoscope. I'm going to listen to the various cardiac valves. Spin this. Okay, here we go. Excellent, so everything sounds good there. Finley, if you don't mind, I'm just going to have you sit back up again. So you can spin your legs off to the side. What I'll do is I'll adjust the camera if I need to. Let's see. Try and bring that up a little bit. Alright, so let's see, what else did we need to check on you? We did the reflexes. Toes. Oh, actually, I know you just laid down. We're going to do the Babinski reflex. So I'd like you to lay back down, put your legs up. Okay, so let's see if we can get your camera on your feet here. And what I'm going to do is I'll use the bell of my stethoscope, and I'm just going to run this up the bottom of your feet. And what we're watching for is to watch to see if you're curl. So just relax your feet. Just relax. Relax. Okay, ready? Yeah, and you can see your toes moving on their own. Okay, we're going to do this side. Excellent. Excellent. Might be a little bit hard to see in the camera. I actually may have been in the way there. Sorry. Okay, Finley, I'm going to have you sit back up for me if you don't mind. Yep. Let me see. I want to look in your mouth again. I just want to check her gums, make her tongue. Excellent. Everything looks nice and moist in there. I just realized we're not on camera again. I'm sorry. So we look good there. Running through everything right now in my head. Let's see. Did your eyes? I'm gonna feel for your nose, her septum. Everything feels nice in alignment there. Trying to think. Did your hair? Did your ears? Everything's in good symmetry. I did your knees, your legs. Oh, I'm gonna a different sensation of for pain. So Finley, what I'm gonna have you do is close your eyes for a minute, and I'm just sit up, sit up, sit up, and I'm just gonna poke you with my pen. Normally we would use like a pin or some sort. I don't have one available right now, so we're just gonna kind of poke around. You just tell me if that feels the same. How's that feel? The same on both sides? Okay, I'm going to do your legs as well. Feels the same? Okay, keep your eyes closed, look up. Eyes closed, okay, going down. Everything feels the same. Excellent. One thing I wanted to listen for, I wanted to listen to your neck. We're listening for any brutes. Okay, so airway sounds nice and clear while I'm over there. Okay. Okay, and I'm going to listen to your temporal poke. Okay. Well, Finley, do you have any questions or concerns for me that we should address?
I'm good.
You're good. Excellent. So, once again, this was my head-to-toe assessment with my patient here, Finley, for Nursing 361. And thank you for your time.
Thank you.